Today I'm talking about ADHD, which has become a really big buzz topic for a lot of people now, and it ties into this whole issue of anxiety and social anxiety, workplace anxiety. It has a huge impact on both workplace performance and productivity, but for those outside the workplace it's also significant for children who are studying, and just the emotional impact on families of even young children, toddlers, who can't concentrate effectively for long spans of time. Now, because we've kept a lot of data and we do a lot of analysis of people's physiology, we have been able to look back over trends over the last few years, and one of the things we've found, because concentration ties into a couple of key areas: your physiology, that's your nervous system, your hormones, issues like that, but it also ties into psychology and some of the habits you've formed and the way in which you've actually either trained yourself or not been trained to follow certain processes. So from a physiological perspective, what we've found is the majority of our people are not synthesizing protein properly, and many of them don't have sufficient whole range protein in their diet. Most people know that protein is very important for your muscular system and for the quality and strength of your muscles. What they don't realise is the importance to do with your nervous system, and in particular your brain capabilities. Then we come, of course, to the B vitamins, and a huge number of people are depleted in B vitamins. So this is going to have an effect on both the nervous system and the adrenal system. So the other things that crop up from our analytics is hormones. So we all know that when your hormones are playing up, your emotions are playing up, and your ability to concentrate plays up. So if you think about from the analytics that we've been looking at, the synthesis of protein, which is going to help us build a strong nervous system and strong muscles, the emotions, which have showed up as one of the biggest impacts on our reports, our analysis, that will affect our ability to concentrate and make good decisions. The adrenal system, which will affect our nervous system, because our adrenal system's playing up, our nervous system's going to play up, and general hormones. Can you see the interrelation of all of these key factors and how that would apply to concentration and our ability to hold our concentration for long periods of time, make good decisions when we need to make good decisions, and switch our brain off when we need to switch it off. That ties into things like relaxation and sleep. So I'm going to shift now to this issue of media and phones and the digital issue, because that's another thing that's changed a lot in the last few years, is the impact of the digital world on our brain. Obviously it's good to have access to information, it's vital, help us make good decisions. The problem is we've become very addicted to a lot of this, and we're not managing our use of media well, social media, or just reporting information, and we're overstraining our nervous system with that. So what we find is grounding is very, very important. So I actually at my office have a grounding mat on my seat, and I have a grounding mat under my keyboard. So I'm more grounded in my office than if I'm in bare feet out on the grass for a few hours, and that would surprise many people. So what we found with our epigenetics analysis is we're looking at about 800 issues for anybody's health. We're looking at 50 issues for the immunity, 30 issues for digestion and gut health, 30 issues for circulation, all of which apply to our ability to concentrate in our nervous system. And this issue of electrical sensitivity has become a big issue. So most offices these days have a huge amount of Wi-Fi and digital media going on at any one time. So as I say, if I'm able to be more grounded, which means electricity is running through my body effectively, and I'm electrically grounded, my nervous system is grounded, in my office and I'm in bare feet outside, it shows there are ways of actually addressing this. My encouragement to you is to actually get an epigenetics analysis done, a proper one, see professionals that know exactly what they're doing about this, put strategies in place that involve good physiology, good psychology, good decision-making processes, good values hierarchy, so you're actually prioritizing the most important things rather than just getting sucked into a bit of a mania around the way your mind's working, and get some proper training on mindfulness and things like that. Our approach is always whole person, whole systems approach, and we get about a 90% success rate with the people we're helping. We absolutely know we can help with this with you, and the colleagues that specialise in the psychological side of this are very, very experienced. They've done this for a long time now. Looking forward hopefully to helping you, and ADHD is something that we can reduce and mitigate easily at all ages, from toddlers right way through to the elderly.